Hello, this is Dr. Gay from First Look MRI, and this is a 7-year-old female with complaints of knee pain. She's a gymnast, and the pain is most pronounced anteriorly. And we have two views here. This is called a coronal view. We're looking straight on at the knee. We see the femur up top, the tibia down below. We see the growth plate here, the femur, growth plate of the tibia. This little bone over here is the fibula. It has a growth plate here, and the growth plates all look pretty good. This is called a sagittal view, looking in profile. And on this sagittal view, we see the kneecap in the front. If we look on the coronal view here, if we go more and more forward, we'll be able to get into that kneecap right here. And on this view, it's hard to appreciate, but along the inferior margin of the kneecap, things look a little bit different, a little bit darker. Marrow should be very bright, filled with fat in the sequence, so the subcutaneous fat is bright. Marrow is bright, and along the inferior margin, we see a little bit of darkness. And this is the patellar tendon that comes down. The patellar tendon is nice and dark here, but near the patella, it's a little more foggy, a little bit brighter. This is the quadriceps tendon, so it looks like there may be some subtle abnormalities here. This sequence, by the way, is not very sensitive for any pathology of the bone or tendon, so we're going to put up another one that is much more sensitive. And here it is. This is a fat-suppressed sequence where the fat is dark in the skin, fat in the marrow is dark. The only thing showing up bright now is edema or inflammation, and we do see that the patient has brightness in the bottom of the kneecap here, also some brightness here behind it, and that patellar tendon is a little bit brighter, a little bit thicker. So this is a case of what we call jumper's knee. The patellar tendon that comes off the tibia here comes up and attaches to the bottom of the kneecap, and patients who jump or land hard or accelerate or decelerate, like this gymnast, have this constant tugging of the patellar tendon on the patellar attachment here. And sometimes the patellar tendon can become thickened and have micro tearing. Sometimes it's the bone will have trouble, and here we see that it looks like it's more affecting the inferior patella than the patellar tendon. But we see that there's brightness in the bone, and so there's repetitive microtrauma, stress-related injury of the patella. And sometimes this will even pull off a little piece of cortical bone or periosteum here. And there's a little bit of brightness back here. This is called the Hoffa's fat pad. And the back of the fat pad is nice and normal and dark. And the front third here, it's bright. This is edema, inflammation related to this. This is a case of jumper's knee from repetitive microtrauma leading to inflammation and injury of usually the patellar tendon, but in this case more in the kneecap or patella itself. And thank you very much.